I think in vitro and in animal models, the more drugs we add, the better it will be. We will be able to kill more malignant plasma cells. But Surbi mentioned it very elegantly. We will be limited by the toxicity and safety. This is why I think we need to play on these new drugs, because we discussed earlier that myeloma is a very heterogeneous disease. There is also this theory which we forgot about it recently, but was very fashionable a few years ago, the subclonal evolution of multiple myeloma. And some drugs may be very effective on a clone, but less on another subclone, which will emerge later, etc. So maybe having also this sequential approach, and that brings us to something I think we need to pay credit to the pioneers, what I would call total therapy. Because total therapy is just trying to fine-tune everything you have in hands that you are able to deliver to a given patient.